Hi, I'm Dr. Sue McCready, holistic pediatrician and co-founder of the nonprofit Get Well for Kids. I thought it would be helpful to show you how I help children find the right diet for health and happiness. It's super simple and really comes to life when you see it visually. I dove into all the details of this Real Health Roadmap in another video, so just click the Real Health Roadmap link below this video for all those details. But here's a quick recap. Health is balance. When Allison is happy and healthy, she's balancing herself back and forth, grinning ear to ear on this teeter-totter. She's bright, she's brave, she's beautifully balanced. If a stressor comes along and she can't adjust herself to rebalance, that's dis-ease. It's like a big thud or rock or person sitting on this end of the teeter-totter. We can use medications to try to rebalance her, but only using medications to manage dis-ease is like putting a band-aid on Allison's boo-boo to make it go away. And every parent knows that bandages don't make boo-boos go away. They cover them up. Out of sight, out of mind, right? Bandages work great for simple cuts where the body can heal and rebalance itself easily. But for childhood chronic diseases, it's a different story. Once you remove the bandages or the medications, the boo-boos or the symptoms return. Once you remove the topical steroid cream, the eczema returns. If you take a break from the stimulant medication, the inattention or hyperactivity come back. So instead of focusing only on the visible symptoms, we need to dig deep beneath the surface of Allison's symptoms and see the real problems that need to be addressed. And how do we do that? We figure out what Allison needs in her environment to resolve her symptoms, starting with her diet. Remember, we are what we eat, digest, absorb, and release. So think diet, gut, detox, and drain. We're going to focus on diet in this video, but before we dive into all those details, let's recap the 3 steps to helping Allison resolve her symptoms. Step 1, we are what we eat. Diet is important, very important, but we need to be able to break down and soak up all that nutrition. And that's why step 2 focuses on Allison's gut to help her be happier and healthier. Our gut or our digestive system should digest and absorb the food we eat so it can get into the cells of our body. I think of our digestive system as a screen door with microscopic holes in it. You can't really see the holes in the screen door, but you can feel the fresh breeze coming through. The same goes for the gut. Its job is to break down our food and soak up all the helpful micronutrients, but also keep the junk out of our bodies. Which leads us to step 3. We need to be able to release our junk. Releasing what we don't need to hold on to requires detoxification and drainage. You can think of detoxification, the process of neutralizing toxins, as calm parents taking overzealous toddlers by their hands before they touch and possibly break another fragile item in the store. Detoxification is very important in keeping our body clean and balanced, and so is drainage. The easiest analogy for drainage is your kitchen sink. You have to drain the dirty water in your kitchen sink if you want the next set of dishes you're washing to be clean. The same goes for our body. We have drainage systems in our bodies to help us clear out our junk. I'm sure a couple come to mind. Yes, pooping and peeing are vital to our health. So let's focus and dive into diet. How do we help Allison find the right, real food for her health and happiness? The food that will help her resolve her symptoms? Well, first we have to accept the brutal truth that there's no one right diet for everyone. I wish there was. That would make life so much easier. Eat this, not that. There, you're done. But there's no one prescription fits all approach for real health. Nutrition is best when tailored specific to a person's needs. Think of it as a suit. Take the suit off the rack and put it on. It fits. It's good. But when the suit is tailored specifically for Allison, it fits on a whole new level. Same goes for food. Eating real food is great, but eating the right real food for you is amazingly better. To boost your health and happiness, eat real food, food that grows as nature intended. But sometimes, a lot of times, it's not enough to eat real food. What? I know. Turns out our food needs to be tailored to meet our unique needs, like a tailored suit. Why? Because even real food can be bad for you. Yep, that's true. Gluten can rip some guts to shreds. Dairy can be hard to digest. Who else feels 3 months pregnant after eating a slice of pizza? I do. The top 3 foods I find stressing a child's health and happiness are gluten, dairy, and sugars. I'm here to share with you it's likely food is a player in your child's eczema, constipation, behavior, or you fill in the blank with your child's dis-ease. Maybe it's allergies, asthma, autism, or ADHD, or mood or sleep disorders. So, how do you figure out what real foods are affecting your child? Ideally, through testing. Let's use our pretend patient Allison here as an example, and in a minute, I'll walk you through her test results so you can see how I help children find the right diet for health and happiness. Remember, the top 3 foods I find stressing a child's health and happiness are gluten, dairy, and sugars. Let's start with gluten and dairy, and we'll cover sugars another time. Gluten and dairy can be real, grown as nature intended. They can also be highly packaged and processed. But realize even the highest quality gluten and dairy can cause Allison problems in 2 ways. Either her immune system overreacts to gluten and or dairy, and her digestive system can't break down gluten and or dairy. In this video, we'll cover how her immune system may overreact to gluten and dairy or any other food. So when the immune system reacts to gluten or dairy or any other food, we call it a food allergy when it raises the antibody IgE, or a food intolerance when it raises the antibody IgG. Technical details, I know, but there's an important difference. Food allergies can be life-threatening, whereas food intolerances are life-disturbing. Both can severely impact Allison's health and happiness, but only food allergies can pose an immediate threat to her life. So it's important to know which she has, or maybe she has both. With food allergies, the immune system reaction is immediate within minutes of exposure. Symptoms can involve the skin, like with hives and eczema, digestive system, like with vomiting, diarrhea, stomach pain, and they can be life-threatening, such as trouble swallowing or breathing, chest pain, or passing out. Turns out 90% of all food allergic reactions are caused by 8 foods: gluten, dairy, eggs, soy, peanuts, tree nuts, fish, and shellfish. In contrast with food intolerances, the immune system reaction is not immediate. It's delayed from 4 to 72 hours after exposure, and symptoms vary widely. For example, if Allison has a gluten intolerance, she can experience bloating, diarrhea, constipation, mouth sores, itchy rashes, headaches, or tics, just to name a few. And it's likely Allison never puts 2 and 2 together to realize gluten is a problem, because her symptoms don't happen within minutes like with a food allergy. Instead, they happen within hours or days after she ate gluten. But here's the bottom line. Both food allergies and intolerances stress Allison because they create too much inflammation in Allison's body. And it turns out that inflammation is a root problem in most chronic diseases, including diabetes, heart disease, cancer, and obesity, but also asthma, which is inflammation of the lower airways, eczema, which is inflammation of the skin, and even inflammatory bowel disease, which is inflammation of the digestive tract. So you can get the picture. Inflammation is a real problem. We need to address it if we want Allison to be happy and healthy. Eliminating foods that inflame Allison will help her rebalance on her real health teeter-totter, and as a result, her symptoms improve or resolve. So let's walk through Allison's test results so you can see which foods inflame or bother her. I generally check for the 8 most common food allergies, which again are gluten, dairy, eggs, soy, peanuts, tree nuts, fish, and shellfish. And depending on the situation, I may check Allison for celiac disease, a genetic autoimmune disorder linked to gluten. Now let's say these are Allison's food intolerance test results. Remember, these are not food allergies, which elevate an antibody called IgE. These are food intolerances, which elevate an antibody called IgG. First, what I see is that Allison is reacting to a lot of different foods. This reflects her leaky gut. Think again of her gut as a screen door with microscopic holes in it. You can't really see the holes in the screen door, but you can feel the fresh breeze coming through. The same goes for Allison's gut. All these foods she's reacting to are from large protein fragments leaking across her gut barrier into her bloodstream. Remember, the gut should break down our food and only soak up helpful micronutrients, not large protein fragments. So we know from looking at Allison's blood test results, she has a gut problem. But let's focus on finding the right real food for Allison. You can see she's reacting to gluten, wheat, rye, malt, barley, and bran. So out of the 7 gluten foods on this panel, she reacts to 6 out of 7 of them. So gluten is inflaming her. Her immune system is overreacting to gluten. The same holds for dairy. She reacts to cow's milk, yogurt, and 2 of the 3 cheeses. If you could see the second page of this test result, you'd also see she's reacting to casein and whey, the 2 proteins found in dairy. So dairy is inflaming her. Her immune system is overreacting to dairy. Now, we won't go through each one of these foods, but you can see also her reaction to egg here. And we don't have to eliminate every single food that she shows a reaction to. But I think it's powerful to see in black and white the body's reaction to food. No test is perfect, but it easily allows us to help Allison zero in on her top 1, 2, or 3 problem foods so her immune system can rebalance. And as a result, she'll see her eczema, for example, improve or completely resolve. And then we know she's closer to rebalancing on her real health teeter-totter. So we're one step closer to figuring out what Allison needs in her environment to resolve her symptoms and rebalance on the real health teeter-totter by starting with her diet. And doing some testing, we're able to see which foods her immune system is overreacting to. In other words, which foods inflame her. We haven't tackled the other way food can be causing Allison problems, and that's if her digestive system can't break the food down. More on that later. But in the meantime, remember we are what we eat, digest, absorb, and release. So think diet, gut, detox, and drain. So diet is only part of Allison's picture, but vital to helping her resolve her symptoms. Healing from the inside out is a process. It can be long and hard, so please don't try to climb Mount Everest in flip-flops without a map. Find a healthcare practitioner willing to walk the real health journey with you, an experienced guide who can illuminate the shortest, least painful path to health and happiness for your child. We're working hard here at Get Real for Kids to build you a practitioner database. But in the meantime, check the links below this video to help your child get started today.